Like, wait a minute. Hold on, doc. Hold on. I gotta ask this question for the people. The people want. I gotta ask this question for the people. Is there ever the right reason for a man to try to get his thing larger? Like we talk about these implants. Just a nigga like, oh my God, that's a legitimate question.
Stay focused, man.
I'm just saying.
Focus, man.
We good.
I want us to do the right thing for this client.
So we just gonna get real with them.
We have to.
I just like to be like a little bit more advanced if you could.
It's always something.
Please do not be driven by money in your decisions. I just want to make sure I point that out. I'm a Christian-based realtor.
Let's be clear.
I can do it. So can you.
Not where I was going with this. All right. Where I was going to go with this. Hey, everybody. I want to welcome you to the RealT podcast. I'm your host, Kenny Donnell. We got Tanika Donnell over there.
Hey, y'all.
We got a great guest today. We have Dr. Gbulie. Now, if I jack his name up, he already told me.
That's right, you can do that.
Yeah, he already told me if he ever put me under, he gonna give me back.
I say that in public.
Oh, I ain't gonna say that in public? My bad. So Dr. Ben Gbulie, we call him Dr. Posh.
Dr. Ben, Dr. B,
Right.
all the above.
The premier plastic surgeon.
Yes.
Right, and why don't you introduce yourself for a second?
Well, hi everybody, my name is Ben Gbulie. I'm a board certified plastic surgeon here in Mansfield, Texas. My practice is Posh Plastic and Reconstructive Surgery. We've been in the Mansfield area here for over 5 years. We offer all manner of aesthetic and reconstructive plastic surgery, and thank you for having me.
Absolutely.
It's our pleasure
Absolutely.
to have you here.
We appreciate you coming. You know, we had to track you down. We had to track you down because you're a busy man.
I work hard.
You have a lot of things going, right? Now we're gonna get into the business in a minute, but
That's right.
we're gonna get to the
We
business
want
in
to
a
know the
minute.
backstory. Like, how did Dr. Ben become Dr. Ben? Now, you're originally from Nigeria?
Yes, I'm Nigerian.
Okay.
And so I did my initial schooling in Nigeria, went to
Wow.
high school, medical school in Nigeria, and I was privileged to have some really accomplished forebears. So for instance, an older cousin of mine was a physician and actually was the head of the physician group in Nigeria. So I had somebody to look up to.
Yeah.
So ever since I was a kid, I always said I wanted to be a doctor.
Because you had it right there in your family.
That's right. But fun fact, when I was in high school about to apply for medical school, I kind of wanted to change my mind. I wanted to do engineering.
They weren't happy.
My dad said,
Your dad's like,
my father said basically that you've always said you wanted to be a doctor, you're going to be a doctor.
why are you changing now?
That's right. Which is why I'm a plastic surgeon. Because now the same things that we've done with inanimate objects in engineering,
You do it
get to
on
do
the
with the human
body.
body.
So you got to merge it.
That's right.
It still worked out for you.
Absolutely. It worked out. I still got what I want.
Very
See, now you just owe your dad your whole life.
I've been owing him, unfortunately, his late, God bless his soul, but he gave me good advice.
Yeah.
Absolutely.
You know, I tell Tanika all the time. So we have 3 girls, right? And I'm like, I know what these girls gonna do. I already know what they're gonna do. Don't worry about it. They don't have no
he
choice.
gives them no option not to. He said they're coming into the business, they're
That's
doing
right.
real estate. And I'm like, what if they want to be a teacher? He said, well, they can teach real estate.
Yeah.
Sounds like my dad.
You know what I'm saying? That's a fact. It's the father's love.
Yeah.
So you have children.
Yeah, I got
a beautiful
3.
wife and children.
Yeah.
And we already know the wife is running it. I mean, you said it off camera, just go say it now.
I'm available for consultation. My wife makes the rules. That's correct. Hi, Didi. No, but we got 3 kids. My oldest, Amaka, she's 15. She's a very driven young lady, and she is smart as a whip. In fact, she's the one that my mom called me and told me, she's smarter than you. Right?
Your mom, your own mama.
I had to remind her, you're my mom.
Right.
You're the grandmother.
And the other 2, Miss Sam she's gonna be the politician. She's 11 and she's a firebrand. And then Obi is just Mr. Smart that I keep trying to say, listen, you gotta read more. He's like, yeah, I'm already smart. I'm like, I know, you gotta read more. And he's 10, so I'm hoping he's getting it. But yeah, they're good kids.
Have either 3 of them expressed an interest in following in your footsteps?
Samantha wants to be a professor.
Okay. Okay.
She just knows that she wants to be in medicine and she wants to teach.
She knows that for now. Okay.
Yeah, so I'm hoping.
You're hoping, right?
Unfortunately, the other two have left me.
They're like, nah, I ain't doing that.
Now, interestingly though, Amaka wants to be an attorney like her mom.
Okay.
And Obi is the one, I'm not sure if he keeps saying he wants to be a dermatologist.
Okay.
But I think it's because he knows they make a lot of money, so I'm not quite sure. I'm not really sure.
Well, like you said, all of them are brilliant, so they can do whatever they want.
Yeah.
He's getting with that money.
Well, you gotta pay for the old school.
That's right.
Well, I'm interested to know how you got to Dallas and why cosmetic surgery.
Well, I do more than cosmetic surgery. I do cosmetic and reconstructive surgery.
Okay.
I do adult and pediatric plastic surgery. And I moved here from Memphis, Tennessee. I had a great time in Memphis. I was in academic practice at the University of Tennessee. And I just felt like the time had come to do my own thing. So
Right.
I moved here. I do have family in the area. My sister is a physician. She lives in Tidal, just 2 hours from here.
Okay.
And that kind of helped. We already had some really, really tightly knit friends in this area. So moving here was pretty easy. And then there was an opportunity to move to Mansfield and build a practice, and that's what I did. And so far, I'm glad to say no regrets.
Right.
And our practice spans not just Mansfield, but Fort Worth
Of
and
course.
Arlington. So Texas has been good to us.
I bet. I bet.
Nice. So reconstructive, you said pediatric.
Yes.
And I know that you've been involved. We talked about it too. Some
That's right.
some cases.
That's right. That's right.
Most recently,
Yeah.
the latest Conjoined twins that were together, you were part of that
That's right.
team.
Yes.
Can you tell us anything about that? Because that had to have been such an amazing experience to be a part of.
It always is. And you know, I don't want to boast, but that was my third.
You have to boast. You have to boast. What do you mean? You have to.
Nothing wrong with that.
It was pretty cool because
And this was your third one?
yeah. So the first two, when I was a fellow in Memphis, we did the
Okay.
first case, and then when I was an attending practicing plastic surgeon, we did the second one. And it really, the thing about conjoined twins is they're different anatomic configurations, and with each set, you just have to figure out what they need.
Right.
In this case, they were joined in the lower chest and abdomen, so there were shared organs. So the pediatric plastic surgeons took point, and that portion of my job was just figuring out how do we open it, how do we close it, how do we get them a healed wound that's
That
functional.
is so
And
amazing.
so far, they've been doing very good. But
Yeah.
the way they came to me was actually pretty cool because my manager, Myra, who's here,
Hey,
was the
Myra.
one that called me and said, "Hey, Dr. Gbulie, a lady called and said that they want to see you for conjoined twins." And I was like,
What?
"Where are the twins?"
Right.
"Oh, they've not been born yet." I'm like, "Oh, really?"
Yeah, right.
So
They're in the womb.
yeah, so it was great because I got to see a pregnant woman in my office for almost 6 months of her pregnancy,
Wow.
every 1 or 2 months.
amazing, yeah.
And I knew it was kind of weird because I'm sure all the other patients were thinking,
What?
"What's going on here?" We're doing cosmetic surgery. I'm pregnant
Like,
woman now.
yeah, when did they start that?
But you know what? It allowed me to get to know the family. I got to know her. I got to know her significant other. And it turned out, small world, that her, the father's, the twins' grandmother actually had a friend who was my patient and who knew from my resume that I'd done a couple of sets of conjoined twins.
Wow.
So when they found out they were pregnant with conjoined twins, she said,
Immediately.
"No, you gotta go
That's
talk to
amazing.
him." And I was really glad that I could give them that comfort because they had thought about going, to Texas Children's in
Sure,
Houston
of course,
and stuff.
of
And,
course.
so I was able to advocate for them. I spoke with their obstetrician and talked, okay, is there any problem with pregnancy? And it seemed like she was having a really
Right.
stable pregnancy, so they felt comfortable that they could deliver here. So I was able to tell them, listen, you know what? If they can deliver safely here, then we can at least assess the twins, and I don't see any reason why we can't do it. And then I got with a team at Cook Children's, and
The rest
things
is
moved really
history.
fast. And you know what? Great job, Cook Children's.
It's amazing.
Wow.
Absolutely amazing.
So I have a couple questions.
Yeah.
Because see, all our medical experience comes from Grey's Anatomy.
Oh.
Right?
ER too. I used to watch
Okay, she watches ER. I don't watch none of that stuff. I just kind of be walking by like, that's interesting. So a couple questions. One, how long did that surgery take for your part?
So it was, I think the total was about 7-8 hours because
Okay.
we actually started.
Did you say 78 or
7 to 8?
7 to 8,
Yes.
okay.
So we got in the room, then you have to, so it's a major surgery. So the first thing we had to do was, and this was all simulated and planned out ahead of time.
Wow.
So there was dry runs, at least a couple of dry runs, because this is, so you're treating 2 patients, right? So there was color coding to make sure that medications don't get crossed, treatments don't get crossed. So anesthesia obviously was pretty important. There was 1 anesthesiologist and a nurse anesthetist per patient at the same time.
Wow.
So the first couple of hours was all about getting them to sleep safely, putting the invasive line safely, and doing all that. And then when we actually started the surgery was me doing the initial incision, raising the skin out of the way to protect it for closure. Then the pediatric surgeons took over, and I just stepped back and assisted them in terms of separating the liver, separating the sacs where the hearts were each other. Luckily, we were able to separate that safely without getting into the heart. And then when we now flipped over and cut the other side, or lifted up and cut the other side, and all of a sudden you now have 2 babies. Then they put them on different table. One baby went to another table, and then the 2 separate teams now in the same room, because a pretty large room and the operating room closed. Now one team closed one, and the other team closed the other.
Wow.
So it was
amazing.
Wow. So I said 2 questions. Now, I'm a voice for the people. I'm finna ask a question for the people.
For the people.
Because
It's for you guys. It's for
we
you.
see these shows and these doctors be in these emergency rooms for 12 hours, 14 hours, 18 hours. I'll be like, man, they got some incredible bladder control. How in the world? Now, surely people got to go stop and take a restroom. Like, tell us TV ain't real.
No, absolutely. It really depends. There's nothing wrong with taking a break when you need one.
Yeah.
Most surgeons that are seasoned have been doing it for a while. Because when you do a complex operation, there's multiple parts of it. So for instance, back to this one, I helped with the opening, but after that, I wasn't primary. I was only primary when we now started closing.
Exactly.
So I had at least 3 or 4 hours where I technically didn't necessarily have to be there. But because I told the pediatric surgeons, I gotta stay here so you guys don't mess my stuff up. So I stayed.
It's my work, right?
But at some point, and then when the kids were separated, the pediatric surgeons did what's called abdominal wall reconstruction using the mesh to repair the abdominal wall muscles. And then I came back for closure. So I had the time to take a break as needed, and I did.
Yeah.
There are some procedures when we do a mommy makeover, you typically don't take a break, but sometimes, like if you're flipping the patient around, etc., you can take a couple of minutes. There is no shame in taking care of yourself.
Yeah,
Absolutely.
Absolutely.
Yeah. Man, with the number of educated people in these rooms,
Yes.
and I know that for the most part, probably a high percentage of the time, everybody is super professional.
That's right.
But do you ever run into those times where that ego kind of takes over? Because you just mentioned make sure nobody messes up my stuff.
That's right. So, yes, but for something this complex, that's why we have the dry runs.
Yes.
Okay.
So what I brought to the table for the planning team and liaising with the lead pediatric surgeon was he had reached out to other facilities that had done these procedures specific to that type, and then I was able to tell him how we did it in Memphis.
Okay.
So one of the things that I emphasized was we want to minimize, or if possible, just completely eliminate the need to make game time decisions.
Yeah.
So in other words, we need to anticipate any problem before we have the problem. So we had different scenarios. What happens if this baby does this? What happens if that baby does this? So that if and when that happened, we already knew what we were going to do. So when you do it that way, ego kind of butts out, because all your ego is if you were involved in the original conversation,
right.
Don't have an opinion now.
So everybody was involved in that conversation.
Yeah.
So there are parts of the procedure where one person is a point versus the other. So for instance, if at any point anesthesia said, this baby's not doing well, then you go into damage control mode, you pack and shit. Because if the baby's not doing well, you can't leave the abdomen exposed, losing fluid and stuff, so you pack and shit. Whatever you're doing, you do an abridged version of it, and you get that's basically damage control surgery. So that's the anesthesia, because anesthesia's role is to keep, I know they always have a big head, but I'll say the most major advances in surgery are from the anesthesiologist being able to do this safely. Because if you can't do it safely,
then
then you can't do it.
Yeah.
Gone are the days where you just needed to like have him bite on something and do what you gotta do.
Those are
So
over,
thank the Lord, those days are over. But yeah, so anesthesia's primary role is to keep the patient safe, in this case, the two kids.
Yeah.
And then when we're doing the actual separation, well, when it came time for closure, I had a colleague, Dr. Gbulie, who was chief of surgery at Cook, who was the plastic surgeon for baby A.
Yeah.
And basically, it was their decision. So on my baby, I decided, okay, you know what, I think we have enough skill, we could close. But on his baby, they couldn't close. So those are the decisions. So I wouldn't reach over and say, hey, no, you got it. No, that's not the way it works.
Yeah.
That's why you have to have clear delineation of roles. And of course, like, I wouldn't be the one telling the pediatric surgeon what to do when he's separated.
Sure. Yeah.
That's not my job. So ego does play a role, but I think that once you recognize that it's not about you, it's about patient, in this case the babies, and I take that very seriously, because whatever I do, I have to go explain it to mom. Pediatric plastic surgery is interesting. You have pretty much 3 patients. Sometimes you have more than 3. Sometimes you walk into the room and the whole clan is there.
Okay.
So yeah, ego can be a problem, but typically it's not. I think we have very good. I think Cook Children's has a very, very good group of doctors, and I'll be honest with you, I had no doubts that we could do it.
Yeah. Let me ask you this, because a large part of the audience are entrepreneurs, or people who are considering getting into the entrepreneurial space, and there's unique challenges that come with that. I mean, you're Dr. Posh. You not only deal with patients, you have staff, you have all these things happening, right? But where I wanted to go with this question first is, as you were going through the challenge, not the challenge, the work that it took to get to where you are. Were there ever moments of doubt?
Absolutely.
Right. And in those moments of doubt, how did you deal with that? Like, how could you help someone deal with, this is tougher than even what I thought it was going to be?
Yeah. So it's interesting. There were significant moments of doubt.
Really? Okay.
And I mean, I'm the guy that's done what you said, done 11, 12 hours of surgery nonstop.
Yeah.
But I still had doubt. But I think that when you have a community and when you have support, my wife has been fantastic. Like, without her, those kids that are doing well wouldn't be doing well, because I'm already there. So you just have to surround yourself with positive energy, right? You have to surround yourself with, and not people that lie to you, that's not what I'm saying.
Right.
But people that help you, people that support you. I remember I celebrated my, I'm not going to say which birthday, but I celebrated my birthday just before moving to Dallas. And that's actually where, like, literally during my birthday celebration was when we did a poll to decide what the Posh logo would look like.
Yeah.
Okay.
So during that time, I remember a speech from one of my closest friends, Dr. Gbulie. He gave a speech at my birthday, and he said, you've always done great things, you're going to do great things, and you're moving to Dallas is going to be a great thing, and that you're betting on yourself. There's nobody else is going to bet on you if you don't bet on yourself.
Right.
So that's the only thing I say, you just got to bet on yourself. If you feel like you have the skill, not the ego, it's not about ego, it's about the skill. Why did I spend time initially in Memphis being an academic plastic surgeon? Because I wanted to see the good, the bad, the ugly, and I saw it all.
Yeah.
Literally. So yeah, you gotta bet on yourself. You gotta make sure you surround yourself with positive energy. You gotta make sure you surround yourself with people that tell you what you need to hear, not what you want to hear. My wife has an A+ in that, because of the things she told me, I know why. And then you gotta get a good manager. That's why Myra's here.
Yeah.
So that support is always important.
Absolutely.
Did you have a 3, 5, 10-year, 15-year plan, or did you just kind of as work it out as I go? Be honest, because everybody does it differently. Yeah, it just started to unfold. It just started. I call that a faith walk. You just started walking. You just started.
How do I say again that life gives you lemons, you make
lemonade.
But the problem is it never really just gives you lemons. It gives you a whole bunch of different stuff.
Right.
So yeah, I mean, I was to be honest with you, I think I was happy when I was in Memphis, but I think my family just wanted more community. and it was very obvious. So I think that when I knew we had to move was every time we visit Dallas, my wife was so much happier.
Right, and then you came back to home.
And I came back to home, and okay, so I kind of read between the lines.
But it's been a good move. Now,
It's been a good
how did you decide on Mansfield? Because you could have picked Frisco, you could have picked anywhere in the Metroplex.
I wanted a soft landing, so there was a group of physicians that was actually actively looking for somebody to join them.
Okay.
And it was that kind of setup where it's more of a cooperative play. And in that group, basically, you came in, there was a management arm of it, and then you took care of your own business.
Gotcha.
So I felt that was a good thing to do to start because, again, we talked about having those doubts.
Yep.
Well, it's not as if the group was giving me any money or anything like that, but at least I could get to town and within a week start seeing patients.
Oh, yeah.
To me, it was that little soft landing that you could get and then, settle. And then once I felt like, okay, you know what, then I left the group and became completely independent.
And how long ago did that happen?
We've been an independent practice now since January 2021.
2021, okay. And primarily, let's talk about a little bit about your practice, if you don't mind.
Yeah, absolutely.
You talk about reconstructive surgery, you talk about cosmetic surgery.
Yes.
What are some of the key things that, like today, you had an emergency this morning.
Yes.
What are some of the key surgeries that you do on a weekly basis? Like, what would you say is your number one surgery?
For the cosmetic arm, it's probably like the mommy makeovers and breast augmentations. And we see a wide variety of patients for that, from 20-some-year-olds to 70-some-year-olds. Age by itself is not a reason not to do, for as long as you're healthy.
Absolutely.
Then that's not a reason. In terms of reconstruction, I do hand surgery, I do facial trauma, and those are, because a lot of people just think plastic surgery is just the fancy stuff.
Right.
I call it the non-sexy plastic surgery,
Right.
but it's equally as important.
Of course,
So
yeah.
you do patients that have nerve injuries, tendon injuries, and stuff like that, and you help them get back to their function.
So on the news lately, you've seen a lot of women trying to go to, and men, I won't say just women, go to Mexico trying to get some surgery. You know what I mean? Can we talk about that a little bit? Why do you think people are, I know they're choosing it probably because it's more cost effective, but what would you say to somebody out there that's thinking about this, the pros and cons of that? Because it hurts my heart to see when people do that.
Yeah, so it's interesting because I have this conversation a lot.
Yeah.
And my opinion is probably not popular.
Well, I still want to hear it. Yeah.
No. But so here's the thing. I ask, so it's not just Mexico. A lot of people leave DFW, they go to Miami and stuff like that. At least every couple to 3 weeks, we get a consult for somebody. I just got one like 2 days ago. Somebody has gone somewhere else and had a problem.
Yep.
Now, if you look at it this way, we live, and I know we live in the social media world. We already had that conversation.
Yeah, we did. Yeah.
Okay, so everything is great, right? Everything's great, Everybody has the best results in the world. Everybody shows you the best results. They never show you the bad results.
Never. Right.
So you take off. You pay for your flight. You pay for your accommodation.
Yep.
You stay there for, if you're smart, 10 to 14 days at least, because you're coming back in 2 days, you're just asking for trouble. And then you have a major procedure. Your healing is not over in 10 to 14 days. It's not over in 3 months. So my opinion is, if you think you're saving 50%, you're actually not. Because by the time you total the cost,
you add all that up.
And God forbid you have a problem. So I would love to sit here and tell you, man, all my cosmetic patients are all perfect. That would not be true.
Right.
However, you know what is true?
What is true?
When they call me, they'll show up in my office.
That's right.
And we'll take care of it.
That's right.
That you cannot put a price tag on it.
Yeah.
It sounds really callous, but the truth is, if you really feel like financially you can't afford it, don't do it.
That's good.
This way, we're not saving lives here. It's cosmetic surgery.
Right.
We may be saving relationships.
But
it's not. So it's true, and I don't want to sound flippant about it.
It makes sense.
But you need to be aware of what you're getting into. There is the expected recovery. There's at least 5 to 10% chance that things may not go as well. And I'm not talking about just major complications. I'm just talking about little things like, okay, you had a liposuction and tummy tuck, and now you're more swollen at 3-4 weeks than you really should be. Well, that's something I would see before you get a fluid collection, I will drain it. That's what you're paying for. But you go to Mexico and you meet somebody who he's probably good. There's no doubt about it. But guess what? You're not Mexican. You're not in the system. How do you know that? Because they said it on social media. Then that means it's true.
Yeah.
There is. I make the joke about. Do you know how difficult it is to get a license in the state of Texas? Do you know how difficult it is to get American Board of Plastic Surgery certification? I can't do stuff to jeopardize that.
No.
And that's the difference. So it's either you deal with somebody like me who's here, who has a practice here, who's going to be seeing you before, during, and after surgery, or you go somewhere with somebody who somebody else said is good, and the guy knows that, oh yeah, how long is she in town for? 5 days? No matter what happens in 5 days, you're gone. It sounds really callous, but sometimes that's exactly what it is. So I think that you're better off pick your plastic surgeon within a reasonable
radius to where you
live. That way, if you have a problem. And then there's also some things that most people don't even, either they don't know, they don't care, or they don't look into. For instance, does your surgeon have admitting privileges in the hospital? Okay, so what if something goes wrong? Well, I have admitting privileges in the 2 hospitals in Mansfield, and like 5 other hospitals in the area. So if I've got a call and my patient said there's a problem, we send them to the hospital. If it's a minor problem that I can take care of in the office, bring them to the office to take care of it. If it's a major problem that needs admission, they're there already. There's no hesitation. You can't put a price tag on that.
And a lot of people wouldn't even think to ask that.
No.
It's really good.
Has it, and for those of you that may not be within a reasonable proximity to Dr. Posh, plan a 2-week stay. Fly yourself out.
Well, go to somebody there where you live.
That's what you should do.
Come see the best. Let me ask you, have you ever, I'm sure you have, but a time where you had to turn somebody away, like they really wanted something and you were like.
And why did you turn them away?
Yeah.
So there's a couple of reasons.
And did they flip over a table when you did?
No, so I think that I try my best to really, so I do, before you sign up for any surgery, I have to talk to you, right? And I have to do a detailed, in fact, I start by going over your medical history. So the fact that you have a medical problem doesn't mean you can't have cosmetic surgery, but the medical problem has to be controlled. And when I say controlled, I mean verifiably controlled. You're diabetic, your A1C is normal, your blood sugars are under control. Okay, then you can have cosmetic surgery. Why? Because if you're not controlled and you have any cosmetic surgery, your risk of infection is higher. Why would I want to put? If you have a problem, I have a problem, right? So I don't like problems. So I need to make sure you don't have a problem, So if you come to me with a poorly controlled medical problem, first thing I would say is you need to talk to your physician, your primary doctor, or whatever specialist you see, and get it under control. And if you can't get it under control, then we can't do it. The other thing is realistic expectations, right? You gotta be realistic about your expectations. For as long as I can look you in the eye and tell you this is what I can do, show you pictures, demonstrate it to you, and I feel that we're on the same page, good. If I feel like we're not on the same page, I have a few guys down the street that I'm referring you to.
So that's what you do. You refer. Okay.
Refer it out.
Yeah. That's fair though, right? That's fair to everybody.
And then some people, for instance, a lot of folks want stuff that they don't really understand. So one of the biggest things that I know that people sometimes complain about is, oh, I want to see Dr. Posh, I want to see Dr. Gbulie, and you're asking me to pay for consultation. Well, here's why you're paying. Because when I sit down with you, we're going to spend 20 to 30 minutes talking about you and what you want. And there's no guarantee that you're going to get anything. But basically, I would be able to go over what you're interested in and go over what my recommendations are. And there's no pressure on you to do it. So you come to me, you say, oh, I want to have a liposuction and a tummy tuck, and your weight is really high. Well, then I can tell you, listen, your weight is so high that I don't even think I can, because we do have a weight loss program, I don't even think we can do that because, there's a difference between, hey, I need you to lose 10 pounds and I need you to lose 50.
Right.
So if I need you to lose like 50, then the weight loss program may take way too long, right? But that's when I can say, hey, you know what, I know a guy, he's a bariatric surgeon, maybe you go see him, maybe he offers a weight loss surgery, and then when you come back on a lower weight, that excess skin that you're complaining about, we can actually do a better job of removing.
Okay.
So in those scenarios, it's not necessarily sending the patient away. It's more like getting a better plan. You know,
One that's tailor-made to them
absolutely.
specifically.
And you know what? You know, I tell patients this, just like you do the surgery on the post-op. When patients are non-compliant, I tell them, you do realize that your body doesn't care whether you paid $1, $10 for it.
I don't care at all, right?
And they look at me like I'm crazy. I'm like, yeah, because your body is going to do, like the human body, physiology and anatomy have been studied for so long. We know what the human body does. Well, surgery is a trauma. It's a controlled trauma. So when we do surgery on you, I expect you to have swelling. I expect you to be at risk of wound breakdown and stuff. So my post-op protocol for you is designed to minimize those risks. So if you're flaunting that,
Yeah,
Right.
that's true.
you know, at some point, I know you want to say it's my fault, but you know, we have personal responsibility, right?
Yeah.
So yeah, so for me, it's really a function of when I have that preoperative consultation, I need to be convinced that the same way you're trying to pick me as your doctor, I'm trying to pick you as my patient.
It
Facts.
goes
And
both ways,
if
right?
I feel like you're not going to be that guy or that woman,
Yeah.
I mean, again, it's not
Not a problem. You signed it up for it.
Oh no,
Yeah,
no, I don't know.
You know, there's a lot of talk, obviously, when you talk about this sort of surgery, people think about women. But have you?
Guys are doing it too.
Yeah. So what are guys doing? Because
Yeah,
wait a minute,
guys are doing it out there.
we need to know what the guys do. But
And
before you
you
get into
know all
that,
the surgeries.
can we work on my six pack? Can we chop
the 2-pack? No, men get liposuction, men get tummy tucks, men get penile enlargement by fat transfer.
Okay.
Men get
They get it all too. Yeah.
some men even get there's pec implants out there.
Okay.
Yeah, to give you more.
So see, if you start, I'm gonna start getting some stuff too. We go.
I'm good right now.
Me
I'm
too.
good. I'm
We
good. But now I know
we
who
going to
called.
Dr. Posh.
Yeah, men are getting a lot of surgery. I mean, I think that the good thing I would say is that the recent stigma, back in the day there was a lot of stigmatization about,
Right.
oh my God, why, you know. But now people understand there's nothing wrong with doing a cosmetic procedure to feel better about yourself. It only becomes a problem if you fix it. Right? So there's that fine
difference
line.
there.
So there's a difference between, okay, I want to enhance my breasts to look better, and I have body dysmorphia. No matter how big I make my breasts, I don't think they're big enough. Those are the people I want to avoid because the truth is you're never going to make them happy.
Yeah.
Right? So, and those are the things that you're looking at when you interact with the patient. You want to give them realism. I'm a big believer in you should under-promise and try to overdo it.
Yeah.
But if you're coming at me and you're trying to get me to overpromise,
Yeah.
then that's where I gotta make
Red
sure
flag,
that we're the
red
right
flag, red
thing,
flag.
you know, exactly.
Now, wait a minute. Hold on, Doc. Hold on. I gotta ask this question for the people. The people want. I gotta ask this question for the people. Is that ever the right reason for a man to try to get his thing larger? Like we talk about these implants. Just a nigga like, oh my God, that's a legitimate question.
Absolutely, and
Yeah.
the answer is yes.
Okay,
You know what the reason is?
I'm waiting.
Because he wants it or she wants it.
Those are all the reasons that you need, right?
Yeah, I mean,
Doc like, I ain't trying to ask no more questions.
and what we offer is really more fat transfer, which means you suction the fat and you deposit it under the skin of the penis, and it gives you some girth.
Yeah.
It doesn't necessarily give you lead. The penile implants that I had are actually for people, the ones that they will the market most are for people that have like erectile problems and
Okay.
stuff like that. So we don't do that. I send them to my urology friends.
Okay. All right.
Well, now
But
you,
since you're interested, I'll be seeing you.
Hold up, Doc.
when you ask the question.
Once we're all done, Miss Mary will make it home. Listen, there is no problem.
Listen,
We got you.
you know I have crossed over 50, Doc. Is this a counseling session?
No,
Oh, we're not
not
that kind of
no.
doctor?
That's
Oh,
private.
man.
Like,
Oh, okay, all right.
oh, Lord.
I'm just saying, I would imagine that even though we hear more about ladies getting these surgeries, I would imagine sometimes guys are probably the most, maybe can be most unrealistic or hard-headed or...
So it's really hard to say that.
Yeah.
I truly think it's individual.
Yeah.
You know, if
Yeah.
if you're that kind of person, you're that kind of person, right? And I think
Regardless
that-
if you're male or female, right?
Yeah, I think that honestly, the sample size is not fair because we see
Sure.
in the reconstructive realm, we see probably a little bit more men than women. But in the cosmetic realm, because more men do like things with their hands and
I
get
see.
injured and
I
stuff
see.
like that.
Okay, makes sense.
But in the cosmetic realm,
Yeah.
we probably see like 90% female. So whatever my opinion is, the sample size is not big enough.
Yeah.
That being said, for as long as you can convince me that's good for you, and I can convince myself that's good for you,
Yeah. We can work it
we
out.
can work it out. Absolutely. Yeah.
Wow. The challenge is, let's stay in this vein because again, we talked about the many roles that you play.
That's right.
And so, as we're talking now about the entrepreneur, the business
That's
owner,
right.
right?
That's
Because
right.
you built your building right down the street here. It's a beautiful, beautiful
Thank you.
building.
Thank you.
Right down from our office, and we get to pass it.
Guess who did all the interior stuff?
I would bet your wife.
Of course. Absolutely.
I knew it. I knew it.
Yeah, that's why my bank account's still hurting. But yeah, it looks good though. It looks good. She told me, listen.
I got
gotta
you.
look
Right.
good. At some point, I said, when are we gonna pump them? But I do think it's beautiful. I
Yeah.
think she did a fantastic job.
It is absolutely beautiful, and you have a great staff, as you mentioned.
Absolutely.
As you got into the point of you branched off, you're doing your own thing, and now you have to hire people, right? Talk us through that thought process a little bit for the entrepreneurs who are listening, and maybe they're ready to make that next step. We get that question all the time.
And I don't know the answer.
Yeah.
And just, staffing is difficult. I think that the best staff you can get are the people that buy into what you're trying to do.
Okay.
That being said, that's on the one hand, and then the other hand, there's a reality that people got to pay their bills.
Yeah.
Yes.
And there's different levels of staffing. It takes a whole group to function. We have a separate set of staff that work in the operating room that help us with our cosmetic surgeries. We have a set of staff that help us in the day-to-day running of the office. And I found that, you know what, I know she thinks because she's there, but Myra's the trick for me. Without her, I can't function.
Yeah.
So in fact,
I can
told
relate
her-
with that because Libby is mine. That's who Libby is to me. Like,
I told her she needs to let her husband know. After 10 years we can now. So yeah, because she puts out a lot of fires that I like, that I don't even know. I'm not even aware that those fires were there in the first place.
Right.
So she does that, and I think that once you have that right-hand person that really understands the role, so it's sometimes like when you're talking and you guys are on the same page, because I can't do it all.
Yeah.
I like to believe that I can, but I can't.
Yeah.
It's
So I think
impossible.
that, and I just think that, but as you find your staff, you have to appreciate them, you have to make sure that you treat them well, because if you're an, excuse the French, a-hole, then they won't stay. And then just be realistic about the situation. Yes, sometimes we work really long hours and you say thank you. You can say thank you with gifts, you can say thank you verbally. Sometimes I think that thank you verbally is actually more important because at least that means you made that effort. So it's still a work in progress. I'd love to say, hey, Posh, we are getting busier, we are expanding. So maybe 6 months from now, when you ask me the question, I'll start bawling my eyes out. But we're trying. I think I have an excellent crop of stuff. Right?
Yeah.
So,
I think people miss the fact that it is a big responsibility,
It's
right?
huge.
When you're talking about bringing people on,
absolutely.
you're not just talking about bringing that individual on, but they're counting on you for their family, for all these different
Every 2
aspects
weeks.
of the every 2 weeks, right? Regardless of what's going on.
That's right. That's right.
And
then don't forget the bank, right?
yeah.
The bank don't care.
The
if
bank
you
don't
do
care. The bank don't care.
well. Actually, let me not say that. My bankers do care.
Yeah, we kids don't be paying all the time. You can see the other side of the bank when you know.
Props to First Financial. They helped us. Our building is owned by myself and by Posh, actually, and Lone Star Orthopedics. And First Financial Bank was very, very helpful with us with the loan process and everything. But You know, they're really nice people, but they want to see the
They want their money.
It doesn't stop.
It
Right?
doesn't.
And at the end of the day, when you go home,
Yeah.
you don't get to just take it off, right?
No.
No. How do you, because we talk to entrepreneurs all the time and try to help them explain the business is the baby, right? The baby needs what the baby needs,
That's right.
not when you want to get it.
That's right.
Right?
And when you miss that, then there's a problem.
There's a problem.
Yeah, it's tough for me because, you know, my manager and I, we talk about this all the time because it is busy. When I'm on call, it never stops. I could be in surgery and my phone is going off, and I need to be able to do multiple things at the same time and do all of them well. And there's no excuses for that. So that's when things like triaging come into play. You know, okay, you got this patient that's shooting in the office, but you got another patient that's coming in for something else. You need to be able to triage and plan ahead. And then when the emergency comes up, so if something were to come up, I'll be calling and say, listen, you know, we're supposed to have clinic. It's not going to happen. Call the patient and apologize. I feel honestly that human beings are good. Okay? So if you called me and you told me that, listen, I know I was supposed to see you at 10 o'clock, but I can't see you because I have an emergency because some kid fell off something.
Yeah.
If I get mad, there's a problem. Because now, is it an inconvenience? Of course it's an inconvenience.
Yeah.
But, you know, I think that for as long as you know that the busier you get, the more potential for those conflicts to come up, and you pay attention to it because every patient is important, every body, every client is important. I think that people are more reasonable and more understanding. So if I'm running late to clinic, I call ahead and let them know. I'm running late, please let the patients know that I'm running late and apologize on my behalf. And I was first thing I do when I walk, I'm sorry I'm late. Because guess what? I wasted your time. I don't like my time being wasted, so I don't want to waste yours. You know?
So I have a question because being entrepreneurs, we've had a understanding that you really often don't get balance. You kind of counterbalance. So how do you counterbalance and spend time with your family?
My wife, she forces me.
Good. So it's like you put it on your calendar. It's a date. It has to happen.
Calendar? Yeah, there's no calendar. She just tells me what to do.
Okay, I get it now. But my whole point is you have to make the time.
You have
and I think
to.
a lot of people miss that because you have to come back and feel refreshed.
That's right.
You know, and you have to give that time to your kids, your family, because time is fleeting.
That's right. I couldn't put it better than you.
Yeah.
You just have to make the extra time. And it's difficult. You know, it's really you. I think that if you are privileged enough to have some sort of business or practice, yes, you work hard, but it's still a privilege because I'm sure there are other people that work even harder that don't have that, right? So could be just because your planning was better, could be because you were at the right place at the right time, could be because somebody gave you a hand and leg up or something, you know?
Yeah.
So so it is a privilege, and
I
then
love that.
at the same time, you also know that you have to have that work-life balance. And I know that I have a couple of friends of mine that are in the same position, and we all struggle with it. You know? But
Because the struggle is real.
Yeah, it definitely real. But you know, I think you have that partner that helps you, like basically tells you, okay,
Yes.
I know you're busy, but you gotta do this.
Yeah.
So,
Yeah. That's
especially when it's things around the house that haven't been done for 2 months.
Especially.
We gonna get to it though.
It's embarrassing.
Yeah, we gonna get to it.
The thing is when, though. We want to know when.
When? We gonna let you know. We gonna let you know.
No. We need to know when. Like, what's the date?
See, we're getting to it.
We're getting to it. Yeah, absolutely. That's the universal. We're getting to it. We learned that in Men 101. We're getting to it.
You know, when those Christmas decorations that they're sitting in the garage, I need to go in the attic, and they're like, wow, it's April Fool's Day.
Are we gonna keep these till December? 'Cause that's what it's looking like.
Sometimes it's actually more, baby.
That same little time, right? You know what I'm saying? Like, just put it up in the corner. It's not bothering nobody.
And then thank God she doesn't ask me to do stuff like put the lights up on the roof. Because with what I do, I've seen some stuff. And I remember once she was like, oh, we're going to pay this guy to do this. I was like, oh man, we're paying so much money to do it. Then I saw a couple of patients that fell off the roof. I thought that's
We're gonna pay them.
Yeah, we're gonna pay somebody to do it.
oh my goodness. totally fine. We just need to try to control the cost a little bit. But don't worry, I am not going up.
You're going to mess around and be referring yourself. Final question of our time here. When it's all said and done, when the storyline is written about Dr. Posh, what would you have? Or how would you define success for you when it's all said and done?
Wow. So I think my definition of success is taking excellent care of my patients. And this is not just my cosmetic patients, but all my patients. I think that the happier I can get people within realistic expectations, the better. My practice is growing, and you said the premier practice in DFW, that's my goal.
Yeah.
And I know that the way to get there is to continue to provide excellent service. We're in the process of seeing if we'll bring another physician on, and that physician, if or when we do, they have to basically have those same principles and goals that I do. If not, we're just going to stay a one-man, machine. But no, I think success for me is just delivering quality care, delivering compassionate care, and just being honest in what you do. Don't make promises you can't keep.
Yeah.
We do a lot of breast cancer patients, and that usually close these patients because during the process you spend a lot of time together and you get to really know them. Most times it's a positive. Sometimes when people are going through pain themselves, and sometimes it's not as positive experience. But I try to tell them, hey, I've never had breast cancer, but what I have is I see people that have breast cancer literally every day, and I see the ones that do well, and I see the ones that don't do well. So what I try to do in counseling with you is to try and figure out the traits of the people that do well, and try to encourage you to be like that. So for instance, there's nobody that has cancer is not going to be afraid. Well, don't let that fear rule you.
Right.
Because if you let that fear rule you, it's almost as if you're professing negativity, and it's going to happen.
Exactly.
And the ones that, because when you're treated, you have a whole team. Normally you have an oncologist, you have a breast surgeon, a plastic surgeon, you have a hospital. You have a whole team trying to help you, and sometimes you just have to let them help you because it's a different. So I think just to bring it back to the question, I think that in terms of success is for every person that we can help, I think that's a plus.
Yeah.
And of course, to be recognized in the Guinness Book of World Records for the Conjoined
Absolutely.
twins. Absolutely. I mean, that's
Working on that.
I told them I could, because in Memphis, it was, we had the first set, and I think it was 4 years later, we had another set.
Now you're in number 3, right? So you guys have heard it first. You're going to be in the Guinness Book of World
Next thing I know, they call Myron.
More business coming. More business coming.
On that note, how can people get in contact with you, Dr. Posh?
It's poshprs.com is the website. We have an Instagram handle at dr.posh.mansfield, and we're here on Regency Avenue, Regency Parkway, 167 Regency Parkway, Suite 101. It's 682-400-2052. And come see us. We'll be glad to take care of you.
Absolutely.
Right. Well, our first edition of our podcast.
And we're so honored to have you.
We appreciate you. It was fun.
Thank
It
you
was
for
a
taking
lot
the
of
time.
fun.
I appreciate you so
Can we
much.
keep going?
Yeah, we're going to keep going.
You got stuff to do. I'm sure by we got these phones.
TikTok on the clock.
It's easy, man. It's easy, brother. This was good. This was fun. I enjoyed it. Thank you.
Good deal.
so much.
We're glad you made it.